We were one of the original sites that started this and pioneered this work in the country, certainly here in the state of Texas. And so over that period of time, Dr. Dewey, my surgical partner, and I have gone through several generations of technology to the point where this is now our preferred mode of treatment for aortic stenosis, particularly for complex patients. And really it matches up with the results of surgery in surgical aortic valve replacement very well. The risk of stroke, heart attack, those types of complications are the same, but the difference is patients that are treated with TAVR leave the hospital much sooner and have less complications post-operatively compared to the surgical group of patients.